All right, let us get started. We just did our messaging on Facebook, and we are still waiting for Doc Griggs to get on. Apparently, Doc Griggs doesn't have his login info, so while I do this live, sorry guys. So while we wait for Doc Griggs to start, let me just go ahead and just start with the slides. This is Handsome. Handsome loves to appear on our site whenever possible. You can find Doc Griggs and I at NOISEFILTER. We have a daily podcast. It's NOISEFILTER, and that runs on all of the subscription or podcast streaming accounts. And you can also find us at noisefiltershow.com as well. You can find more information about the things that Doc Griggs and I are doing on a regular basis there. So with that said, let's just go ahead and get started. Again, thank you so much for being here. This is, again, our COVID-19 daily live stream. We do this every day at 4 o'clock. We also, again, have a 10-minute daily podcast. For the last couple of days, it's actually been logging in at about 8 minutes. And so it's really high-yield information as brought to you by both Doc Griggs and myself. So let's go ahead. Let's start with some of the global epidemiology. You can see here the global number of cases is about 4.3 million people. So again, our cases are continuing to go up. Of course, you can see overnight we've added about 74, almost 75,000 cases. And that's about right. Hang on one second. Doc Griggs says nothing. Hang on one sec. Hey, Chris, if you're watching, can you help out Doc Griggs? For some reason, he's not able to figure this out. All right. Anyway, so as we continue on, you can see the number of deaths globally is reaching about 300,000. We added about 5,000 deaths last night. That's about normal. But also, let's just be clear: there's nothing normal about any of this. This is incredibly abnormal, and the fact that we have so many deaths on a regular basis is, continues to be pretty shocking. But here we are, and again, let us be very clear that, hang on, it won't come up. All right, Doc Griggs is having a hard time. Chris, can you help Doc Griggs get online here? Hang on one second, guys. I'm sorry. Okay. So again, you could see that moving to the New York Times. And remember, the New York Times is still is about a day late, even though it does says it's updated. The worldometer is a little bit more up to date, and it looks like, if you look at it here, it looks like there seems to be a trend downward in global cases, and so hopefully that's something that sticks. But I have a feeling that that's not going to necessarily be the case, as we'll start seeing in the next few days as cases continue to go up. Now, again, we are enjoying this nice period of time where it appears that mortality seems to be dropping significantly. And again, we saw the worldometer at about 5,000 cases, so we'll expect that this peak will be here tomorrow or so. But again, we are enjoying this relative period of, probably there was a slight decline in cases. But again, as we're starting to see countries open up again, we will be seeing an increase in those cases as well. So Looking at the U.S., we have well north of 1 million. We're rapidly approaching 15, or rather 1.5 million. You can see we added about 20,000 or close to 20,000 deaths last night, and our number of deaths is about 1460 in terms of addition, and that now works out to about a person per minute. Yesterday we essentially were at about a half a person per minute, or rather one person every 2 minutes. But for some reason that has not necessarily been the case. I'm gonna see if I can stop sharing, see if I can get Doc Griggs on, and apparently I'm not sure why he is not able to get on with us. So I'm just gonna continue. I'm going to continue on with what we are talking about, and hopefully we'll be able to get Doc Griggs on. Again, if you look at our total deaths, we're about 83,000, and you can see we are rapidly approaching the World War I levels here. I'm again still dismayed and shocked. I remember when we were somewhere right around here, and the idea of getting close to World War I levels just seemed incredibly not conscionable to me. But you can see that we are rapidly approaching that. We are enjoying what appears to be a decline in cases, and so that is good, although again, I suspect that these numbers are going to start going up. We have been talking about that, but overall, there is this decline, and so as of right now, these cases do appear to be going down, and I'm not, I sincerely hope that these numbers end up going down all the way to zero as much as possible. In terms of the number of deaths, this again appears to be going down as well. But again, these numbers don't reflect what's really happening. Going back to the Worldometer, we were looking at almost 1,500 deaths. And here, this is not reflecting that. So this is about a day late or so. I anticipate these numbers to be going up a little bit tomorrow. But there, does appear to be this downward trend. And again, I hope amongst hopes that this continues to be the case. Looking at the testing, we do have, again, this is the country with the most amount of testing, is about 160,000 tests per million population, and that belongs to Iceland. Iceland's done an amazing job testing their population, but you can see somewhere where we are, we're about 29, almost 30,000 tests per million people, which puts us behind Canada and Singapore, and just a little bit, we're just an inch above the UK as well. In terms of the COVID tracking project, what's notable here is, again, our total tests are going up. And again, if you take the total number of positives here and divide it by the total number of tests that were given, and so that's this positives number here plus this negative number here. And when you take these two numbers here and add them, you have the total test results of positives and negatives. When you take that total positive and divide it by the total negative, essentially you have about 15% in terms of a positivity rate. So essentially where we want to be with a positivity rate is we want to be under 5%. And so we are still well above that. This still implies that there's a pre-test probability that's really quite high. And so that means we're still testing people that we suspect that have COVID-19. And again, where we need to be is well below 5% to know that we're getting an adequate sample of the population. So we're able to pick up on those people who may be pre-symptomatic or asymptomatic as well. But may not feel like they have COVID, but they end up actually really having it. So when we look at the state of Louisiana, and I'm going to do another check on Doc Griggs, see where he is. When you look at the state of Louisiana, we're at about 32,000 cases, with our deaths about 2,347. We added about 19 cases overnight, and added I'm sorry, my apologies. We added 502. I was wondering, that was very low. We added about 502 cases overnight with about 80 deaths. And you can see that Jefferson Parish still has the highest amount of cases total, with Orleans Parish following quickly behind it. When you look at mortality, Jefferson Parish is about 405 deaths, whereas Orleans Parish is about 477 deaths. It's nice to see the illustrious Dr. Doc Griggs. Welcome to the show.
Thank you. I've never felt more old.
Well, if you look in the mirror, if you see the way you look, hopefully you feel old that way.
I see nothing but youth. It's not until I start doing this techno stuff. Where is the 10 print 20 go to 10 equation in the Commodore 64? Because mind.
Some old references right there.
Yeah.
Maybe you'll just hold on to that link with the password.
Yeah, so it was weird. Chris and I just went through some stuff, man. Like, I don't want to distract you with my my ineptitudes of technology. You were on a roll. Let me not interrupt.
All right. Let me know when you want to get an Apple. I'll help you choose the new MacBook Pro.
Oh, don't start, dude. I got the iPad. I got the iPhone. I'm almost there. Just give me a minute.
When you look at the Louisiana case rates, we are really doing, either we're doing really good by falling lower, or other states are doing bad. We're about 1, 2, 3, 4, 5, 6, 7, 8. So this is a new low for us. And here's where a new low is actually good, right? So we have about 6,894 per million number of cases. So that essentially means that our growth has starting to slow a bit in comparison to other states. And I anticipate that you're going to start seeing some of the southern states that opened up, some of the more rural states, as the virus starts to infiltrate into some more of those rural areas, are going to start climbing up this list. And that's largely because their populations are low. So even a small increase in cases is going to make those relative numbers quite high. When we look at the mortality rates, we still kind of high, 1, 2, 3, 4, 5. If you look at this is largely New York, New Jersey, Connecticut, Massachusetts are all northeastern states. You can see Louisiana is the first state that is in the South that's on that list of mortality. And again, we have to remember that the mortality that's happening amongst those with COVID, especially those in the South, especially those in Louisiana, are happening particularly in populations that tend to be more lower income, that don't have the ability to work from home. So they're obviously have higher rates of exposure. We're seeing a significant disproportionate amount of deaths in communities of color. And of course, when you add all of those together, these are all diseases of poverty, and the risk factors for COVID-19 are happening as a function of diseases of poverty, right? So folks that have diabetes, folks that have obesity, folks that have cardiovascular disease are all diseases of poverty more than anything else. When you see our testing rates in the state of Louisiana, 1, 2, 3, 4, 5, 6. We're number 6, 49,000 per million people. I think that we can do better. We should do better and strive this state to continually try to keep us on top of this list. I certainly know we're going to be going over the Orleans Parish plan in just a moment, but I know that there is a solid plan for this. Looking at the Louisiana daily curve, it looks like we are definitely in some plateau right here. You're going to see these little ups and downs, and I hope I'm wrong. and I'm sure Doc Griggs will talk about it in a moment, but there's going to start seeing an increase in cases that we've predicted. Our mortality appears to have gone up just a little bit, but again, this is reflecting yesterday's data more than anything else. This is looking at Brazil, and it looks like Brazil is starting to see a slight decline. And that's great news, and I hope that's sustainable. And you're seeing that decline also happen in mortality as well. Looking at the dashboard, this is the complete Louisiana dashboard. You could see in blue is Louisiana, whereas in yellow or in gold, this is Orleans Parish. You can see that the number of cases are still more or less rising in the state of Louisiana. And you can see there's minimal growth in Orleans Parish. When you look at the number of deaths, you could see almost daily there just seems to be increasing mortality. We have not seen a downward turn in that, and you can see the same here in Orleans Parish. And then lastly, number of tests continue to go up, and that's great. When you look at deaths by race in Orleans Parish, you can see overwhelmingly this is again a disproportionately affected an African American community, followed largely and far away by the white community. Looking at the number of ventilators in Region 1, we are doing very well in terms of availability of ventilators. We're doing great with the ICU beds, and we're doing great with hospital beds in use. Before I turn over to the Orleans Parish data, I wanted Doc Griggs to see if you wanted to kind of offer anything up in the interim.
I was actually doing math. So 77%, if you round up, of the deaths in Orleans Parish are African American.
How many deaths did you say? 77?
Was that 360 out of a total of 470? Was that what I saw?
Yeah, let me go back to it. Yeah, I think that's what it was.
Yeah, that's 76.5%.
Yeah, there you go.
Dude, like it's shocking. That was
it crushes the soul.
Yeah, that one really kind of I wasn't expecting to see that. I thought I knew it was at least 70, and I thought, and I'm being somewhat of it's not even a devil's advocate. I'm just being naive, intentionally naive. But Doc, I thought we were doing better. So you mean to tell me at this is stable? This is, I mean, that's amazing. Wow. So we need to really up the intensity of our messaging about basics to the basic things that we need to do in order to protect ourselves. The wearing of the masks is imperative to decrease the viral load. And again, I'm going to keep hammering it. You get tired of me saying it, I'm just going to ignore you as always and keep pushing it. This mask is not a surgical mask. This is the equivalent. This is a fabric mask. And Doc, by 80 to 90% of us wearing this mask, from what you're telling me, and I want your numbers, not mine, Doc. We've been talking about this for 4 days, and I've just been pushing you into uncomfortable, comfortable places for you to speak over the last 2 days. I don't know if you see the trend, but I really want to hear your voice with this mask thing. That number just shocked me. I mean, while I was looking down, I was doing math. I was trying to do it with my fingers. And then I pulled out my hand. I'm like, no, that's 76%, 76.5%. So, wow, I don't even know what to say.
Yeah, it is shocking, and it's hard to kind of wrap your head around. But that is just, unfortunately, that's what we have going right now. And I wish that news was better. This is largely due to centuries of just institutionalized racism in the country toward communities of color as well as minority communities. The inability to accumulate wealth, the inability for access to education. And I think, also more importantly, or mostly as important, is the lack of or difficulty in accessing quality healthcare and just healthcare period, let alone quality healthcare. And, I think that there are a few silver linings with COVID-19, but I think that this is likely to be, possibly one of them. The idea of just really shedding light on something that we've known for a long time, and we've been talking about this in the HIV world. We've been talking about this in the hepatitis C world, and we talk about this largely in a large part of the world in which we see diseases of the poor, which typically are infectious diseases, disproportionately affect vulnerable communities. Malaria, HIV, and TB are the number 1, 2, and 3 killers in the world, and those do not happen in Sweden. These are happening in countries where you have incredibly vulnerable communities. And so with that being said, I was going to click over to, I managed to find Dr. Avegno's presentation from yesterday, and I figured we'd go over it. You want to see it?
Yeah, definitely do.
All right. So this was the presentation given by Dr. Avegno yesterday.
Mighty handsome cat, by the way.
Yes, I think she knows that as well. Her name is Handsome, and she loves to jump on to the table whenever we are doing a Zoom call. And for some reason, this is the time that she's most behaved. So otherwise, she's always whining. All right, so this is, you can see here, looking at the total number of cases that we've seen over time, just here in New Orleans. And this is just looking, this dot right here is just looking at the number of deaths that we've had, that we've talked about. Thankfully, hasn't even reached 500 yet. So you could see that we've had an enormous amount of cases. Fortunately, with the with the mortality rate. I wonder what is that mortality rate? Is that 46 divided by
46 divided by
46 divided by 600, basically, right?
So wait, say what was the 46 again? I'm sorry, I was trying to find this article. It just came through. 46 divided by, what's the denominator?
Divided by 600 is about 7.6. So yeah. So so this is a, it's still a shocking mortality rate. Now, some people would argue that mortality rate is elevated because we don't have the actual true number of cases. If we did, this denominator would be bigger, which would of course make this number seem a lot smaller. When you look at the tests that were performed in New Orleans Parish, we've done about 30,000 tests, which reflects about 7.7 residents. You can see when the majority of that testing was done was kind of right around the time that we introduced testing here. There's the numbers that the city uses, about 3% of the tests are positive. Now, we talk about that positivity rate back when we do, like, for example, when we show you this slide, right? And we take this number of positives and divide it by the total number of tests. Now, in the US, it comes out to be about 15%, but in Orleans Parish, it comes out to be about 3%, which really reflects that we're doing a really good job of testing all individuals, whether they're symptomatic or pre-symptomatic or asymptomatic. So that means that our pre-test probability for testing somebody is not high, and that's what we want. So this will capture an accurate number of tests. Dr. Griggs, I'm not sure if you can see, but all we can see is just the very tippy top of what looks like a beautiful dome.
Yeah, my bad. I was sitting back just trying to really take in and do the math here. So if we've tested 7.7% of our residents, I want people to understand before they go out and get too comfortable that there are 92.7% of us that have not been tested, that could be asymptomatic, maybe not. Before I see what I saw on the way down here, and we get comfortable with no mask, dapping each other up and hugging each other again, we need to understand that the virus is still out there and we still need to protect ourselves.
That's right. That is right. So here in this slide, this is what they were referring to. There's the gating, and this is what they're going to be looking at as they move from one phase to the other, right? So the first are looking at symptoms, which is a downward trajectory of the flu-like or COVID-like illnesses. In terms of looking at cases, it can be a downward trajectory of positive cases. So not only are we seeing a decrease of cases that look like it, right? These are symptoms of cases. They're also going to be looking at the number of positivity. They want to see that number going down over 14 days. And this is with enough adequate testing of about 4 to 5% of the population per month. And then, of course, we need to do the contact tracing that we talk so much about, right? Remember, the whole process here is for us to test, trace, and isolate, okay? Then we want to be able to make sure that hospitals are available so that we have the ability to treat without any crisis care and ability to surge. In other words, that we still have a lot of room to go up. And when we talk about here, this dashboard here in Orleans, you can see we have a lot of ventilators available. About 50% of our ICU beds are available. And the total of hospital beds, we have about 1/3 of our hospital beds are available. So you can see that the plan is being activated to make sure that the healthcare system is ready to absorb should there be any increases in cases. Now, of course, what everybody wants to know about are the plans, right? This is the stuff that Doc Griggs and I are going to geek out over, and all of your epidemiology friends are all going to, be wondering about. But of course, the majority of the population is going to, figure out or wonder about the sector, workplace, employee guidance in place, and this sort of stuff. So what are the actual plans? So we'll get there in a second. So when you look at the first milestone, what we're looking at is a continual decrease in cases over time. And when you think about where we are with the peak, we are significantly lower. There was some consideration of either a 14-day decline versus a 21-day decline. They opted with a 14-day decline, but right now we are well beyond a 21-day decline of cases. So that's good. That means that in Orleans Parish, we are definitely moving in the right direction. We're moving in the place that we want to go. That's great news, okay? When you look at the average number of tests, essentially 500 tests a day is what the average should come out to be for us to maintain roughly that less than 5%. And you can see we're well above all of that. We've far exceeded the minimum amount of testing that we've needed to do on a daily basis, which has left us in really good shape. When you look at contact tracing, right now we have about 70 contact tracers. By May 15th, the hope is to get to 270. It's an increase of about 3 times. I certainly hope that ends up being the case. And then by June, having 700 plus more. And then the health department will help augment a need. Again, this is incredibly important. Again, when we think about that we need to have enough testing capability and enough tracing capability as well. So this way we can kind of assure that people are able to stay home and to isolate. So milestone 4 is looking at hospital capacity. So this is looking at as number of cases gone up, right? As we've had more cases, you've seen that the number of hospital beds have become more available. That may sound counterintuitive. I think what this is reflecting is that we're testing more, we're seeing more asymptomatics that are positive. Otherwise, we do have plenty of hospital beds that are available. And if you look at the number of ICU beds available as well, you could see where region 1 is this blue line. You can see that as time goes on, as the pandemic has passed, that we've seen that more and more ICU beds have become available.
Can you go back to that side for a second, please?
Which one do you want to see?
The one on the right. I want to talk about that dip around April. I'll go over, the dip on April 29th, April 30th.
Yeah.
The spike on the 3rd.
Right.
The 3rd, 4th.
Yeah, let's see what the 250, 200. So, that was that like, do you think people just got out of the IC? I don't know. Like,
so as it goes, it takes a precipitous fall. Does that mean that means more beds are available as it goes down?
No, that means
daily bed availability, and as it goes down, the number of
that means
spike in admissions, right?
Right. That means there was just they got crushed. The hospitals got crushed on these days right here.
Yeah, slammed. I want to know what happened. I wonder what happened on
Yeah. Yeah.
2-3 weeks before that.
It could be that there was some event, a parade, a second line,
When was Easter? Easter was what day?
Okay, Google, what day was Easter?
Sunday, April 4th, 2021.
So April 4th was Easter. So somewhere right around here.
And if we go 3 weeks?
Yeah, it's probably a little too much.
Yeah.
The exposures happened, I bet you, right around here.
Yeah.
Right here. That seems to me to be a little bit more. So let's just see. So here they're talking about that the guidelines that the city's using are based on CDC guidelines, based on Johns Hopkins best practice, and then Resilient Louisiana Commission guidelines as well. And then the goal, of course, is to protect against repeated COVID spike by slowly reopening the safest sectors and industries, allowing some individuals who cannot work remotely to get back to work while protecting them through and through. And boy, do I agree with that sentiment. Keeping the elderly and high-risk individuals at home and out of harm's way, and then avoiding reopening known locations such as high super spreader potentials, venue with high public traffic, festivals, large group settings. These are things that we know transmit virus pretty significantly. In progress, however, go ahead.
No, I just want to go back to that slide. It said Sunday, April 12th. Sunday, April 12th, 2 weeks would have put it at the 26th, right? And if we said 2 to 3 week spike at the 27th, 28th, 29th, 30th, we'd have been right on.
Yeah.
So my point is that my point is that when you're talking about super spreader events, like the ones that are potentially going to happen this weekend, the math and this is science. We're basing what we're talking about on science. Doc, it took a while to get my smile because he was like, where is Griggs going with this? I'm proving this exact same point. Everything that Dr. Dery and I sit here and tell you about wearing the mask, about we think it might be, don't get overly comfortable because super spreader event. Easter was April 12th, and we said 2 to 3 weeks.
No, April 4th. No,
I'm looking at the calendar. I'm looking at my calendar.
Oh, it could be that maybe it was giving me April next year's Easter. Okay.
Yeah, April 12th. We've been saying it since the very beginning. 2 to 3 weeks. Watch what happens. Watch what happens. And I'm saying this for a reason. Hanging out with someone that's infectious disease, as OCD as they all are. The first thing that he said was, "Dude, you need to get a thermometer." I'm like, "What does he need a thermometer for?" Like people, they need to wash their hands. I get. He was correct. I really started studying the science of this, like in detail, and the math has been correct every time. So we've been saying it on the radio. I said the same thing about the pulse ox. I went and bought a pink one, of course.
And look at this one, nice and black. Look how black it's nice and black.
We're talking about the happy hypoxics, and we're talking about cytokine storms and people falling off the O2 saturation curves. So here we are telling you again, folks, and here's the math, here's the science, here's everything that you want from an infectious disease doctor, community medicine, health literacy, translating it so you understand. If you do not continue to social distance and take care of yourselves, if you go out and you have these events, the parties, all the stuff that I saw this past weekend, and I've seen even on the way here, in 2 to 3 weeks, you see where that curve falls off and the availability of ICU beds becomes a lot less, it crashes. That's going to happen, and it's going to happen again. And by the time the ICU beds become unavailable, that means the system from up to the ICU beds has backed up and is starting to fail. We don't want to be here again. I'm sorry I had to bring it there. I still got the Fauci thing from earlier on my mind, and everyone, all the scientists.
We're going to talk about that.
Yeah, sorry, but it took me a minute, but you finally got where I was going. I'm good. I'm off my calculator. Soapbox. Continue. Sorry.
Whew. That poor calculator. I feel sorry for it. Yeah, I lost where I was.
Variability in progress.
That's right. Again, so essentially, the rest of them is just, recognizing these super spreader events, gatherings, churches, business meetings, casinos, theaters, extended close range, face-to-face interaction. So these are things that we need to really worry about here's our updates. Before we go into that updates, I'm going to let Doc Griggs, try to spell out words with his calculator, things that we used to do when we were young. What happens when you take 6006 and turn the calculator upside down?
Oh, dude, keep going. Don't do that. 7734, right?
Unbelievable. That still makes us laugh.
Every time. Every time.
All right.
Yeah, science can be fun, folks, too. We just told all of our age. I mean, yeah, that was an ET moment. Ouch. That was, yeah.
Before we go over the updates, any words? I wanted to say a couple words. I think that the city's doing a great job. I think that the calculations of their numbers have been super spot on. It's nice to see the city. I wouldn't expect anything less. Again, the mayor, along with her health department, have been doing a great job keeping us notified with these numbers, keeping us notified with the information. Again, I do want to share with you this amazing tool that the city has come up with, which essentially is a dashboard that is updated regularly. You can look at this at the NOLA Ready website, and you can see, some numbers all at one time. And by keeping us up to date, it allows folks like Doc Griggs and I to be able to help other people understand what the numbers are, where they're going, and how best to approach and explain what the city is doing on a regular basis. Doc?
What I really appreciate most is the fact that they've taken the approach that you and I took, and I took that journey for a reason. This is not speculation. This is all based on math. If you want to see the math, if you want us to show our work, here it is. And this is what we're counting, which is why I went through that exercise intentionally. Doc, what was the date on that again? And let's count the dates. We said 2 to 3 weeks. Well, we do know one thing. The virus is following a pattern. We know that much about it. And it reads the books and uses my calculator, because in 3 weeks, sure enough, people started to get sick, and that's sad. But my point is, this is not speculation. This is nothing to, and the fact that they have a dashboard so you can actually follow it yourselves. If you want to, I've become more versed. I'm intentionally taking more classes in epidemiology to become more versed, so I can help you interpret as the viewer. And Dr. Dery and I can really have intelligent conversations. Listen, the best way to show someone respect is to do your due diligence before you sit down to have a discussion. So in this infectious disease world, we're here for you. If there are words, if there are phrases, if there's anything you don't understand, we're more than willing to explain and just talk through it, because just because we can read and count doesn't make us brilliant. You're brilliant. Everyone has their gifts, and we would love to discuss this thing intelligently with anyone. Doc?
All right, good. All right, so let's finish off here today. These are some of the things that we need to know. Top health experts testify that the U.S. is not out of the woods and warns against reopening too fast. And as Doc Griggs says, now in the news that water is wet.
Yeah,
Here we go. What are your thoughts about that? You watched some of that testimony.
So I'm going to tell you, if you don't speak first, I'm going on mute and I'm going on strike. You've been dying to talk about this. Fauci, no, I've been dying to hear you talk about it, because Fauci got up there and defended science and scientists the entire time. We've been saying this. We've been talking about defending science for 2 years. And here we have a science disaster, a pandemic. And we're defending science. And the discussion that we had earlier, I mean, there's a practical side to it too. We're used to being in the silo of science and not really having to justify what we're doing, because it might be on a micro level. This pandemic has affected every aspect of the entire world. And I mentioned to you earlier, this is the first science exercise I've ever been a part of that's been polarized, that has politics between economy and science. And believe it or not, political party versus political party. And it's just a foreign world for us to operate because we don't think that way in science. Just like we went through the math exercise with the graph to show you what we were talking about. I guess it's not as simple a decision, Doc. I mean, I can't put it in the goal for you. I can just put it right there and I'm going on mute, man. I want you to talk.
I mean, what do you say? It's, I would say Dr. Fauci has made an art of being able to correct Donald Trump without directly contradicting him. Because
which is essential for survival, and we have to do
in that administration.
Yeah, you have
that administration.
Right.
In other administrations where people were more intellectually honest, President Obama. In other administrations where you could respect the intelligence of the president, Jimmy Carter. You would, folks would want to be challenged. I know that the people that work with me, I encourage them to challenge me. I encourage, Doc Griggs. It doesn't happen often, but every once in a while he does succeed in challenging me. It's a one-sided relationship where I oftentimes challenge him more than he challenges me. But I'd like to think that it's going to be a little bit more equitable as we move forward.
He's taking advantage of the fact that I was going on mute. I'm being respectful of my elders, right? I'm being respectful of my elders, and I'm letting him finish. Just y'all have pity on him and listen, okay? Don't interrupt. Look, he got his teeth in right now. So just he got all day, he put his teeth in.
Well, I saw that you put yours in.
See what I mean? Those old corny jokes, yeah.
So I think that that Fauci came, he came with all the data filled to the teeth with it, right? Sitting in his living room with all those books packed in the back. He just was, he went toe to toe with Senator Rand Paul. Senator Rand Paul, who ridiculously called himself a scientist in the middle of the hearings. But I just remind you that Senator Paul got tested for COVID-19, tested positive, but at the same time, after he was tested, did not isolate himself, which is what you should do after you get tested. He continued to go to the Senate pool, and then the day he ended up being positive was in the Senate gym as well. And Senator Paul as well, a board certified ophthalmologist, but also the boards that he took to get his board certification was a board that him and a friend created so that they could sit for their own ophthalmology boards and take their own boards. Did you know that, Eric?
No, but to me, that doesn't negate the fact that he went through a scientific process. I don't get in that. Yeah, I didn't know that, but I don't get in that.
I'm just saying. So anyway, that he was trying to go toe to toe with Anthony Fauci, I found to be somewhat offensive. And they were talking about schools and they were talking about Kawasaki. And we'll talk about that in a second. But just there's nothing more to say, Eric. I mean, like, Fauci just spoke the truth. I mean, you can pit the truth up against lies. You can pit the truth up against about people who are trying to be malicious. And in the end, and I'm sure your grandmother, who is an amazingly brilliant woman, would say regularly, just like my grandmother said, always tell the truth, because you never have to worry about what story you told in the past, because the truth will always win over. It was a valuable lesson for me to learn as a child, and certainly this is something that we're seeing happening here. And the truth is this: we are not ready to open. We were caught with significantly unprepared.
We don't have enough tests. We don't have enough contact tracers. We don't have a public health infrastructure that is intact enough for us to be able to continue to do the things that we enjoy doing, which is engaging in an economy without getting more people sick. Therefore, we are going to see more people get sick, and therefore we are unfortunately very likely to see people die. And that is the tragedy with all of this. Doc?
I don't have a, if I had a mic, I would drop it, but I have keys, so I'm gonna drop the keys. You drop the keys on that one. I mean, that's, you've been dying for me to do that for like 2 years to let you go. And today's a day. Now, on the other side of that, considering the fact that we are in, because of different facets of this whole process, there is pressure to open. And since we are opening, I think the powers that be are doing the best they can to make sure we do it as safe as possible. But what you have to appreciate, and Doc is starting to learn that it's the way Annie Mae taught me. I let the process take place. Then I tell you the lesson that I wanted to extend was that the data is going to lead. And I think that everyone that understands, in spite of doing what they might not agree with on principle, they have to do because of job's sake and positioning, that the data has to lead. Just like the data has led the phases, has shown that it's, yes, in considering the situation, we're going to be as safe as possible about reopening. Understand, just like you saw that precipitous fall in the number of available ICU beds, if the data starts to predict otherwise, which Doc and I are saying that it will, at some point, we're going to have to be more restrictive and go back in until we all understand. Again, the literacy portion, now you got me sitting up. Let's talk a little community medicine here. The literacy portion is that in communication, the equation is sender, message, receiver. A lot of people leave out one of the most quintessential components of that equation is the feedback. There has to be a mutual dialogue between the person trying to give the message and the person receiving, which in essence turns both of them into both parts. Because the purpose of communication is for both parties or all parties to walk away with a mutual understanding. You might not agree, but you have a mutual understanding. So as long as we understand that for those that are dying to go back out and to go to the bar and go to the happy hours, of which you will not see, I can comfortably say, Doc or I, or Dr. Fauci or anyone else.
You won't see us there.
None. If that are dying to do that, understand that the virus is still there and that you do run the risk of contracting the virus. And if the numbers are high enough where they start to see a spike and we start to see the decrease in available beds, we will be back to where we were 2 months ago, and things will have to shut down again, and it will take longer to get back out again. The other thing to be clear about is, we talked about the second wave. We're not out of the first wave yet. We're not out of the first wave. If we keep having spikes, it's going to be a while before we get out of the first wave. And then we still have to worry about the fall when it's seasonal. We have 16 weeks. We have 16 weeks before, no matter what, another wave is either coming to potentiate and make this one larger, or it's going to be one that comes like another tide. But in order to be prepared for it, understand that the data, the decisions that you're hearing, at least as far as the people that the governing bodies that we know, are going to be driven by data. And who generates that data but the community, our behavior.
That's exactly right.
Yeah.
All right, just real quickly, because we're starting to get short on time. Testing becomes a flashpoint in the Senate hearing. I think what was happening here was that the senators were saying we've done plenty of testing, and then people like Fauci were like, no, we haven't. Yeah, all right. That was a big sip from his cup. Apparently, Doc Griggs really likes to take a big sip from his cup.
Don't worry about my cup, Dr. Dery.
House Democrats propose, oh, here you go. You got one party that wants to propose some money, but the Senate just on the other side says, nah, we're not going to do with that. So we'll skip over that. We don't do politics here.
Right.
Senator Paul and Dr. Fauci, or should I say Dr. Paul and Dr. Fauci, clash over the effects of the virus on children and reopening schools, as we have reported on several times here on this show, as well as our other show. And in fact, please consider downloading and subscribing to the NOISEFILTER Podcast. This is a podcast that Doc Griggs and I do every day for about 10 minutes a day. And it's high yield information. So what we've talked about is that children now are experiencing something called a pediatric multisystem inflammatory syndrome, which looks like and could be related and or is a disease called Kawasaki disease, which is a disease in which is the multi-system inflammatory system. I will also say, I don't know if you saw Dr. Paul refer to COVID-19 as COVID-16. He also referred to Kawasaki disease as Kawasaki syndrome. I'm just saying those were just funny errors that he made. And the issue here was that he felt as though that it was fine to reopen schools, and Dr. Fauci pushed back on it. And I thought made some very compelling arguments over what I thought Senator Paul's arguments were. The Dr. Fauci emphasizing the need for multiple vaccines, just because just one vaccine isn't likely going to be doing the job. Dr. Redfield mostly avoids questions about the new set of CDC guidelines for states to reopen. I'm going to let you take that one, Dr. Griggs. What about those CDC guidelines, and why won't Dr. Fauci or Dr. Redfield answer questions from some of the Democratic senators as to why it was never released?
You really?
I was just putting the ball right at the rim, and I just wanted to make sure that you were going to be able to just tip it right in.
I just said that before we jump into that and start pointing fingers at the CDC.
Nobody's pointing fingers.
What they did or didn't do, there might be some things going on that we don't know about. It's called bureaucracy, folks, behind the scenes. Sometimes it's due to standard of product. Sometimes it's due to disagreement over content. And then sometimes it's due to just a locking of horns. We don't know what happens in behind closed doors and in someone's house is in their house. But all I know is that they do exist. And eventually we're going to find out one way or the other what we need to do. Yeah, you put that one right. Yeah, you put that by the rim. Yeah.
The CDC came up with guidelines on how to reopen the country, and unfortunately, those guidelines have been blocked by the White House. And under the CDC director was not interested in answering questions that may have been embarrassing either we couldn't tell, that may have been embarrassing for the CDC or may have been embarrassing for the White House. And he took a very diplomatic position in terms of not answering. And then lastly, we're up to about 100 children now in New York that are suspected of having a rare illness tied to the virus. And again, this rare illness goes back to this story right here, which is this idea of pediatric multisystem inflammatory syndrome, which is something that you're going to be hearing a lot more of. I think that of all the things that are coming from this virus, I think this story is going to be one of the most important stories that we see over the course of the next couple of weeks, maybe even over the course of the arc of this story in the US, because I think what we're seeing now is a new disease, or recognizing a new disease that we've never seen before. Any final words, Dr. Griggs? We're rapidly approaching the hour.
That was the point that I wanted to make real quick. I wanted you to clarify. We're saying, and this is what we've done before, when in science and in medicine, when we see something that looks familiar, we're quick to say this looks like, with the understanding that this might not be. This might trigger a reaction that looks like another one, but the nuances, it's the devil in the details. The nuances are about this virus in particular, what make everything different. At one point, we wanted to treat this like viral pneumonia. We couldn't do that. Then we wanted to treat it like altitude sickness. Can't do that. This virus is carving its own unique niche. Kawasaki's disease, the disease we're talking about in kids, has a treatment, the therapeutic treatment that we don't know about that treatment here. Now, there was a discussion on Air Coronavirus Corner yesterday that you and Dr. Aber had, but stay tuned, folks. We'll talk more about it.
All right. Our daily podcast is called Noise Filter. You can subscribe to it on all the podcast platforms that you utilize. Please subscribe if you like it. Please leave us a rating and also any comments as well, so that more people can see our podcast. This podcast, YouTube Live goes on daily from 4 to 5 every day. Thank you to Access Health Louisiana for making this possible. Thank you to the ATC. Thank you to Chris Atkinson, for whom none of this could be possible. You could ask Doc Griggs about that, because I would have done that show by myself.
Yeah.
Thank you. Thank you, Mr. Atkinson. And thank you for our whole ATC team that supports this show. Remember, please stay indoors. Please wear a mask. Please wash your hands. And remember, health is a human right.
Get checked, get fit, get moving. Wash your hands. Wash your hands.
Peace out.